Hi, good afternoon, everyone. I'm Kylie from Center for Health Activation. So thank you for joining us today. So before we start our health talk, there's some admin matters. Should you have any questions, please feel free to input your questions in the Q&A function below. Yeah, so our speakers will be answering your questions at the end of the talk. So please be patient and just put in your questions and inputs. Yeah, so today we have our speaker, Staff Nurse Bibi Wong, and then Staff Nurse Tian Si Ai from National Center for Infectious Disease, Ward 9F, who will be giving us a health talk on understanding tuberculosis. Thank you.
Good afternoon, everyone. My name is BB. This one is my partner, Si. Thank you for taking your time to join us in these sharing sessions on this tuberculosis. Okay, so this is the outlines of today's content. So we will introduce on these two forms of TBs and its transmission methods, followed by the screenings. If you ever come into cross contact with TB cases, or if you presented with TB symptoms, then after that, I will explain on how the doctor actually come up with the diagnosis, treatments, and what are the prevention methods that you actually can implement to prevent the spread of the TB within the communities. So some actually say that TB is no longer in Singapore and only exists outside of Singapore. So it is a true or false statement. Can anyone from the crowd try to answer this? Okay, so this is actually a false statement lah, because TB is actually still endemic in Singapore and still present in the population. In fact, 30% of the cases are actually elderly. Although there was a decline in the number of reported TB cases in the past 6 years, in 2022, there were still 1,251 new cases of active TB cases detected among Singapore residents. So TB remains as a public health concern because it actually associated with a high mortality rate. Based on the statistic in year 2020, estimated 9.9 million people actually failure with the TB worldwide, and 15% of the infected population, which is 1.5 million of the people, actually die from the disease itself. So much more remains to be done to prevent the spread of the TB within the community and within the worldwide. So what is TB? TB is actually caused by a bacteria called Mycobacterium tuberculosis. In Malay, it's actually known as a batuk kering. In Mandarin, it's actually known as a 结核病. There are other names also for the TB, such as consumption, disease or wasting disease. This is because people infected by the TB usually have this loss of appetite and loss of weight symptom, causing them to become thinner along the disease process. In the early 18th century, TB also known as the white plague, because people with the TB disease usually have a paler appearance compared to the other people. So there are two forms of TB. One is active TB disease, another one is called latent TB infections. So when you expose to the TB germs, which form you were presented with actually depends on how your immune system reacted to the TB germs. So commonly, when we expose to the TB germs, our immune system will start kick in and prevent the TB bacteria from continuous growing. So our TB bacteria actually will become inactive and asleep. So this is a stage called latent TB. At this stage of infections, you will not have symptoms and do not feel unwell. You are not infectious because you cannot pass the TB germs to the others. However, there is actually 10% chances that your latent TB can become active sometime, somewhere in the future, maybe a few years' time. So you still need to receive a treatment even though your TB bacteria are considered inactive. So when the TB bacteria becomes active, so you actually will exhibit the symptoms and then you will start feeling unwell. So at this stage of time, you actually consider infectious and can pass the TB to the other people. There are some minority group of the people actually when they comes into contact with the TB germs, their body cannot actually stop the TB germs from multiplying. So they will actually straight away exhibit these active TB symptoms. So how does the TB is transmitted? It's actually transmitted through the air from person to person. usually require a cross and prolonged exposure that actually occur in a enclosed environment, such as an air-conditioned environments with poorly ventilated environments lah, and require a long exposures, which is usually 8 hours or more cumulatively. So what are the activities that can actually prevent the spreads of the TB? Can anyone want to try to answer from the grounds? Actually, the only way, right, to get the TB germs in your body is actually by breathing them in. So the activities that actually can cause the spread of the TB will be through the singing, coughing, and the sneezing. Because during this process, right, the air vapor that generated actually contains the TB germs and can remain in the air for up to few hours lah. So for the people who actually share the same household and live in the same room with TB cases also has a high risk to contract this TB disease. However, activities such as kissing, sharing food or utensils, sharing toothbrush will not causing the spread of the TB because the TB cannot spread through the saliva. Same goes also, TB cannot spread through contact by touching the bed linens or the toilet seats. There are other factors also that can actually affect the transmission of TB, such as the infectiousness of the source cases, what are the activities that causing the suspension of the respiratory droplets in the air, and how contagious the virus strain is, same like the COVID. So the intensity of the environments and the duration of exposure also plays a big part in this transmission of the TB, like what I mentioned in the early part. So it also depends on the vulnerability of the contact. Those young and adult immunocompromised individuals, such as those on the chemo treatment, on the long-term steroids, those undergoing dialysis also has a higher risk to get the TB infections. So the high risk group of the TB also including those who actually have a link to the country where TB is common, such as when you are traveling to the area whereby the TB number is actually on the rise. Yeah, and when you actually come into cross-prolonged contacts with a person has been this TB disease. Individual with underlying medical conditions, such as those with a HIV infection or diabetes, or individual with a weakened immune system due to drugs or sickness, especially elderly, has a higher tendency to infected with this TB disease. People with a poor nutritional status, those substance abuser, drug addicts also has a high risk to get the TB because they have a weaker immune system. So those with a history of prior untreated TB, this part is actually referring to the latent TB. So over years, it might actually become active TB disease and causing infectious symptoms. Hence, the only way to prevent the spread of TB, right, is by identifying people who actually have a close contact with the TB cases and start treatment as soon as possible once diagnosed. Some of you might actually heard in the news about the TB cases last year in Singapore, whereby 7 cases actually found within from different units within the same blocks in Bukit Merah. So therefore, the MOH actually conducted a free screening test, and 30% of the people who attend the screening test, which is 170 people, actually tested positive for the TB. Therefore, the Singapore actually made it mandatory for the remaining people who never turn out for the test to come for the screening test as soon as possible. This is very important to prevent the further spread of the TB disease within the community. So it's very important also for you to actually go and seek the medical attention whenever you actually presented with the symptoms that is similar to the TB. The TB symptoms in the early part of the disease, right, you see it's quite slow and may go unnoticed for a prolonged period of time. In fact, some of the people, right, actually asymptomatic in the early part of the disease process and only pick up that they are actually infected with the TB during the health screening or during the pre-employment checkup. So the symptoms of the TB, including a prolonged cough for more than 3 weeks, and some people might actually cough out blood with blood stain sputum, and they actually having this unexplained tiredness, loss of appetite, loss of weight. Some might even present with a fever and night sweat as well. So what you can do is that you can go and consult the doctor at the nearest GP clinic or polyclinic. So if the TB is suspected, right, the doctor may actually do further tests and refer you to the TBCO for the screening. Should the TB, latent or active, be confirmed, appropriate treatments will be given to you. So next, I will hand over to my colleague Si to explain further on the diagnosis, treatments, and the prevention of TB.
So if you think that you have TB, or if you have been informed that you have been exposed to someone diagnosed with TB, these are some of the tests that you may expect to be conducted for TB screening. So at the doctor's consultation, your medical history will be taken and a physical examination will be done. If the quantiferon blood tests are positive, a chest x-ray will be done to check for active TB. The sputum test may be needed depending on the chest x-ray result and also your individual health conditions. So now let's move on to the treatment methods for the two forms of TB. Active TB disease requires prompt treatment, so it is treated with a combination of several anti-TB drugs for at least 6 to 9 months under directly observed therapy. It is otherwise known as DOT, which is under MOH regulation for active TB patients. So patients will have to undergo DOT at either the TBCU or polyclinics to take each dose of their medicine. They will be observed by a doctor, nurse, or a trained personnel. The main purpose of DOT is to ensure that patients are compliant with the TB treatment because the TB germs are difficult to treat. This is also the reason why treatment is long. So if the treatment is incomplete, the patient may develop drug-resistant TB later on. The number of DOT sessions can range from daily to 3 times a week. So next, if you have latent TB infection, it is possible to take medication to prevent yourself from getting TB disease in the future. This is also known as preventive treatment. So the doctor or nurse at the tuberculosis control unit would advise if it is beneficial for you to take preventive treatment. So even though treatment is offered for latent TB infection, it is not compulsory to undergo preventive treatment, especially in patients with liver issues who are deemed not suitable for the treatment. So in this group of patients, they will have to undergo 6 monthly follow-ups in the clinic. So those who undergo preventive treatment will be taking anti-TB drugs to kill the TB germs in your body before they become active and cause TB disease in the future. Anti-TB drugs used in preventive treatment include rifampicin for 4 months or isoniazid for 6 months. Unlike active TB, latent TB treatment does not require DOT. So the most important thing in the treatment for TB is to comply with the treatment plans and take your medications as prescribed by a doctor. Also, it is very important to return regularly for checkups to ensure that you are well and not experiencing side effects from the prescribed medications. So what are the anti-TB drugs? Like all medications, TB medications have side effects as well. So these medicines are taken orally and available in either tablet or capsule forms. So firstly, we have isoniazid. You may experience nerve problems such as dizziness, tingling, numbness around the mouth or leg. You can continue taking this medicine and inform your doctor at the next visit. Taking vitamin B6 will help to prevent or lessen this side effect. So a patient taking isoniazid experienced a stomach ache which was resolved after he took the medicine with food. Secondly, we have rifampicin. So a patient who had rifampicin said that he was surprised that this medication turned his urine, saliva, and tears bright orange. So do not be alarmed. Rest assured that this is a normal reaction by the body to the medication. It took the patient some time to get used to this side effect, and he had to make some adjustments in his daily living by switching from wearing contact lenses to glasses while he took rifampicin. Oral contraceptives may not work while you're on rifampicin as well. Hence, it is suggested to use alternative methods of birth control to prevent unplanned pregnancy. You may also have sunburn due to sun sensitivity. Hence, you have to remember to apply adequate sunblock. There can also be easy bruising as there is slower blood clotting. Similar to isoniazid, if taking rifampicin causes gastrointestinal distress or nausea, it is recommended to take the medication with food. Thirdly, we have pyrazinamide. So similar to isoniazid and rifampicin, you can take this medication with food to prevent stomach discomfort. So if you experience joint aches, you can apply cold packs or heat packs to relieve the ache. And lastly, we have ethambutol. You may experience visual changes such as blurred vision, eye pain, loss of vision, or inability to distinguish red-green colors. So stop taking the medication and seek medical attention immediately. So there are some risks involved if you're not compliant with TB treatments. Poor adherence to TB medications can lead to drug-resistant forms of TB, which take longer and are harder to treat. So as mentioned earlier, latent TB treatment can take about 4 to 6 months, and active TB treatment can take about 6 to 9 months. The drug-resistant form of TB can take about 2 years to treat. A person with TB can suffer complications and even die if they do not seek appropriate treatment. So why are regular medical health checkups important? When you attend the clinic appointments as scheduled by the doctor, liver function will be monitored through blood tests. This is because the anti-TB medications may affect your liver function. Chest X-ray and sputum may be done to monitor the treatment response. Generally, the cost of screening and treatment of TB are either heavily subsidized or free of charge. For contacts identified by TB contact tracer, the screening and treatment are covered by MOH. Medication to treat the latent TB infection will be provided free of charge. Active TB treatment at the TBCU is heavily subsidized for Singapore citizens and permanent residents. TB medications are free of charge for patients under DOT. So if you have active TB, how can you keep your family and friends from getting sick? Here are some of the suggestions from MOH. So completing the full course of your TB medication. You must complete all your medicine, even if the symptoms go away and you start to feel better. Stay at home in the first 2 weeks of treatment, except when attending DOT treatment at polyclinics. This is to avoid further spread of the bacteria, as you are more likely to be able to infect others with the TB bacteria during this time period. After undergoing at least 2 weeks of effective treatment, you are generally considered non-infectious, provided that you continue with the remaining treatment. As mentioned earlier, TB can spread while in close and prolonged contact with the affected individual. Hence, remember to wear a face mask in the presence of other people during the first 2 weeks of treatment. Avoid close contact with anyone who may have low immunity, including the elderly, young children, and pregnant women. Remember to practice cough etiquette by covering your mouth with a tissue when you cough or sneeze.
Ladies and gentlemen, may I have your attention, please?
Okay, sorry for the interruption. Okay, so remember to practice cough etiquette by covering your mouth with a tissue when you cough or sneeze. So keep your home well ventilated with windows kept open. Also remember to avoid alcohol because alcohol when taken with isoniazid, rifampicin, and pyrazinamide may increase the risk of liver problems. So if you're contacted by the authorities for TB screening, it is strongly encouraged for identified individuals to protect their own health and the health of those around them. Overall, these are some of the take-home messages for the presentation today. Tuberculosis is an infection that usually affects the individual lungs but can affect other parts of the body as well. It is caused by bacteria. The two forms of TB are active TB and latent TB. If you have active TB, your infection can spread to another person, meaning that you are contagious. Latent TB can turn into active TB, so it is important to get treatment no matter which form of TB you have. Take your medications as prescribed by your doctor and adhere to follow-ups. to complete the full course of TB medications. So TB is in fact curable. Severe complications and death can be prevented with early diagnosis and effective treatment for active or latent TB.
Hi everyone, sorry there was a disruption with our audio just now. So now we'll resume the Q&A section. So now I'll pass on my time to the speakers.
Okay. Sorry for the interruption again. So, TB is in fact curable lah. So there are severe complications and death which can be prevented with early diagnosis and effective treatment for active or latent TB. So we have come to the end of our presentation. These are our references. Okay, so if you have any questions, you can enter in the Q&A segment. Okay, so there was a question regarding any symptoms of TB we can look out for. So I'll just go back to the slide. Here. Okay, so if the symptoms are usually prolonged cough, which is defined as cough for 3 weeks, and sometimes can even cough out blood in the sputum, and then can also have unexplained tiredness, loss of appetite, and weight loss, fever, or night sweats lah. Yes, elderly needs to be extra cautious of TB. So this because of their weakened immunity system, which makes them more prone to getting the TB infection. So they're also part of the high risk group earlier on, as mentioned here. Yeah, because usually elderly will have a number of underlying medical conditions. So this also makes them more prone to getting TB as well. The question was, do elderly needs to be extra cautious of TB? Okay. So there was a question asking on how common is TB in Singapore and if there are any ways to prevent. So back to the slide here. TB is actually, there are still a number of active cases diagnosed in Singapore every year. So more than 1,000 cases every year. So despite the efforts that was put into curbing the spread of TB in the community, there's still a number of cases. So these are some of the prevention methods that we can take note of. Here. Yeah, so basically it's very important to complete the full course of the medication. Otherwise, there's a chance of getting drug-resistant TB if you don't complete the treatment. And then stay at home for the first 2 weeks of treatment, except when you are going for DOT, wearing face masks, and then performing cough etiquette, and then keep your home well ventilated, avoid alcohol. So this is basically to protect yourself and the others around you from TB.
So for the latent TB germs, like what I mentioned earlier on, usually the person will be asymptomatic and non-infectious. So usually it's quite hard to know beforehand whether you have this latent TB germs, and commonly it's only found out during the health screening or when you actually go for the pre-employment checkup, or when you actually come into contact tracing for those TB cases. So there's one question that actually asking whether is it advisable to screen for TB as part of the health screening purpose, even though one would not suspect himself or herself to have it. Because if you actually do the screening for TB as part of the health screening purpose, right? Actually, the blood test itself will cost around 200 plus lah. So this one you might need to discuss with the doctors, like what are the reasons that you want to include this TB test as part of the screening test, health screening. Because usually, right, only when one suspected he or herself having the TB symptoms or actually come into cross contact for the TB cases can actually go ahead with this health screening. So where can you actually go for this TB health screening? You can actually go to any polyclinic or GP clinic. So from there, they can actually refer you to the TBCU for the screening itself. There's one question also asking whether is there any possibility of relapse once cure. So for this question, the possibility of relapse actually is very, very low. So you need to complete the whole treatments as recommended by the doctors lah. So commonly for the active TB, after 2 weeks of the treatments, you are considered non-infectious, but need to complete the durations as recommended by the doctor. Yeah, let me show you the slide. Yeah, which is actually 6 to 9 months for active TB, and latent TB is 4 to 6 months. However, if you are having the drug-resistant TB, it actually will take longer, 2 years. The chances of relapse is very low. There's one question actually asking for those diagnosed with latent or active TB, could they have the BCG vaccination instead of taking the medication? Okay, when you actually diagnosed with the TB, you need to receive treatments. Means that you need to take the antibiotics lah to actually cure the bacterial infections. So the vaccination will not help you to free from these TB infections. There's one question actually asking, TB patient will also undergo contact tracing like COVID. So for this answer is yes. Usually once a person has been tested TB positive, right? TBCU staff actually will do a contact tracing and asking who are the cross contact lah. So after that, the TBCU staff actually will do the contact tracing and inform them to actually come for the screening test. Is there any more question from the grounds? Yes, Debbie. Hello.
Okay, and hi everyone. So thank you for joining us our health talk today. So in view that there's no more questions, so for now you can actually do our feedback form. So your feedback is valuable to us. So please scan the QR code on the left side of your screen to share your feedback with us so that we can improve and do better. So at the same time, if you would like to find out more information on other topics, please scan the QR code of the TTSH library at the upper right of your screen. Yeah, so we would also like to share there will be an upcoming Central Health Talk on 18 December 2023 on a Monday. So with the topic, how to preserve a severed finger. So if you are interested in this health talk, please scan the QR code on the lower right of your screen to register your interest. Thank you. So we were leaving this screen on for a while for you to scan and stuff. Yeah. Okay, so we have two more questions coming in. We will have our speakers answering the questions again. While y'all can scan this QR code. Thank you.
Hello, hi. We actually received a question regarding whether the TB is hereditary, because there was a family whose members actually contracted the disease, although they did not stay together. So for this answer, right, actually TB is a communicable infectious disease that is will not pass through the hereditary. So there are a number of possible reasons why the members actually contracted disease. They might actually contracted from the community itself, even though they did not stay together. Because the TB, right, only was spread from person to person through the airways and then through a cross and prolonged exposures. Do let me know whether did I answer your questions. There was also a question whether for there was also a question that whereby asking for people with chronic conditions such as diabetes, will there be any symptom of TB as their immune system may not be as good? Like what I mentioned earlier on, right? The TB symptoms can be actually develop quite slow in the initial part of the disease. So if you ever suspected that you have symptoms similar to this TB, such as a prolonged cough for 3 weeks, especially when you call out the blood sting frame, it's recommended for you to actually go and seek the medical attention. So these are just take note of what are the possible symptoms of TB, such as a prolonged cough, extreme tiredness, which is unexplainable, loss of appetite, and unintentional loss of weight, as well as a fever and night sweats. These are the most likely symptoms when you actually presented with a TB. So usually, right, the cough, right, is a duration, is the symptoms. You actually have this prolonged cough that never resolve, that's lasting more than 3 weeks itself. So some people, right, they will actually cough out the blood with the phlegm with the bloods. Initial part, maybe it's a dry cough, but eventually they might actually cough out with the phlegm, with the bloods. The keyword is a prolonged cough for more than 3 weeks. If you have such symptoms, it's recommended to actually go and see the GP doctors in the polyclinic. Hi, there was a question that is actually asking whether the BCG vaccination will help to prevent contracting the disease. BCG vaccination is actually recommended for the babies and young children because they actually can provide consistent protection against the severe forms of childhood TB, such as TB meningitis. However, it can be less effective against the TB affecting the lungs in the adults. So for this one, right, usually after the babies and the children's getting this BCG vaccination, it actually can provide protection up to 15 years. So like what my colleague mentioned earlier on, to prevent the contracting the TB disease within the communities is actually required good hygiene, good cough ethics, and then make sure that the home is actually well ventilated.
Hi, there was a question regarding if foreign domestic workers are subsidized for consultation and medications for TB. So regarding this, so if they are contacts identified by the TB contact tracer, then the screening and treatment will be covered lah. However, if there are any other queries, you can contact the TBCU lah for more details. Okay, so thank you all for your questions. And we have come to the end of our presentation. So before we end, we would just like to extend our gratitude to Brother Hasri for his guidance, Sister Joria for reviewing the sequence, Sister Tovel for advice on the content in this presentation. We would also like to thank CHA team for vetting through the slides. So thank you all for your kind attention.
Okay, thank you to our nurses from NCID Ward 9F. So as mentioned just now, so do our feedback form on the left side of your screen to help us improve, and then so that the next few health talks will be better. Yeah, so if you guys would like more information, do visit our TTSH Health Library website. Yeah. And then if you guys are interested to attend more health talks, we have an upcoming one in December. So do register your interest, yeah, from today onwards. So I'll leave this screen on for a while for you guys to scan the QR code and then do up the feedback form. Thank you.